This is the first of many videos on ECGs that will start from the very basics and teach you the process to read EKGs in a systematic way. In this brief video, I'm going to talk about the heart's conduction system and give an overview of what an ECG shows. So first off, we have this diagram of the heart. So let's get oriented. We have over here the right atrium going down into the right ventricle. Up here is the left atrium going down into the left ventricle. So the heart's conduction system starts up here where the sinus node is. It's located at the top right of the right atrium. From there, the electric signal of the heart goes down to the AV node. At the same time, the right atrium also sends some signals down to the left atrium, allowing the left atrium to also depolarize. So going down from where the right atrium goes to the AV node here, the AV node is also known as the gatekeeper of the heart. It basically conducts electricity at the slowest rate and thereby stops fast rhythms from the atrium to enter the ventricles. So from the AV node, the signal continues to travel down the His bundle and then splits up into the left bundle branch and the right bundle branch, and then goes around all the way to each Purkinje fiber. So that's kind of the general flow of the heart. You'll start at the SA node, it goes to the AV node, down the His bundle to the right and left bundle branches, down to the Purkinje fibers. So the overall direction of the heart's electrical circuit is down and to the left. Right? If we were to draw a vector that kind of shows the overall flow of electricity, we would draw a vector that kind of starts up here at the right atrium and then goes all the way down towards the left ventricle, which has the most kind of muscle in the heart. So basically what an ECG does is that we put sensors all around the heart, kind of looking at the heart from all different directions. And each electrode that we place around the heart allows us to get a snapshot of what the electrical circuit is doing from that electrode's perspective. This then allows us to see, is the circuit healthy or not? And based on that, we can interpret what is the problem that's happening, and as a result, we can treat different conditions that are causing abnormalities in the heart's rhythm. Every part of the circuit of the heart has an automatic rate at which it depolarizes, known as the intrinsic rate of depolarization, and it sends a signal to the rest of the heart to depolarize and then contract. The SA node typically depolarizes the heart at the fastest rate, at around 60 to 100 times per minute, and therefore it is the dominating force. However, right, if the SA node stops working, these other portions of the heart can take up the job of depolarizing the heart at a lower rate. So, for example, the AV node, right, it can depolarize the heart at 40 to 60 beats per minute, and whereas the bundle of His and Purkinje fibers have a much lower rate at 20 to 40 beats per minute. So what an ECG shows is a snapshot of the electrical circuit of the heart from different angles. So in this specific PQRST complex that's shown down here, let's break it apart and see what each part means. So starting with this P wave here, the P wave indicates atrial depolarization. So as the atria depolarizes, it sends signals to the left atrium, which also depolarizes, which kind of corresponds to the width of the P wave. And then this segment all the way from the P wave to where the QRS complex starts, this is known as the PR segment, and this is the time it takes for the SA node to send its signal all the way to the AV node. Then as the AV node depolarizes and sends signals to the left and right bundle branches down the Purkinje fibers leading to the ventricular depolarization, this is all captured within the QRS complex here. After the ventricles depolarize, there's a period in which they're not able to depolarize again, and during this portion, it takes a little bit of time for the ventricles to repolarize, and once they do, this is where the T wave comes in. So this is kind of the overview of what each portion of the PQRST complex shows in an ECG. And there's a common question that you'll be asked, right? You'll be asked which part of the ECG shows atrial repolarization, right? The important thing to remember, right, is the P wave is showing atrial depolarization. The QRS is showing ventricular depolarization, and the T wave is showing ventricular repolarization. So now the question is, when does the atria repolarize? And the answer is that it's actually within the QRS complex. We are just not able to see it because it's a much kind of smaller deflection than the QRS complex here is, and it's kind of hidden within it. So that's kind of the answer to that question, and something you'll probably be asked at least once on rounds, if not more. So we'll continue to discuss ECGs in our next video, in which we'll discuss lead placement and overall how to actually get an ECG with the right equipment.